Following segment of Studio 4 is sponsored by Dental Renaissance.
Welcome back, everyone. Joining us now is our friend Carrie Blankenship. She's a dentist and the owner of Dental Renaissance. She joins us today to talk about some of the special treatment options she offers and how she can help restore or replace your smile. Carrie, let's get started by talking about your practice and the role you play in people's lives.
Yeah, absolutely. So I am a sole owner of a private practice here in Plano, Texas. I'm the only dentist that practices here. We have a few wonderful hygienists that are also providers, but I am the only dentist. My practice really focuses on comprehensive and like continuity of care. It's really important for my patients to know the practitioners that they're seeing and not be referred out for every little tiny procedure that they may need. So I pretty much do it all for my patients. I have kind of an extensive background in dentistry. I brought all of that to my practice when I chose to own my own practice. So there's a combination of Invisalign, routine dentistry that people just need, just for checkups, cleanings, things like that, the random filling or crown that's here and there. When people need root canals, we can provide that treatment. And then I've also had a lot of experience with surgical procedures as well. So we do things as simple as a filling and a cleaning all the way up to full mouth implants. So it's very, very comprehensive. I do all of it. I want to make sure my patients feel very comfortable in my chair.
Tell us more about the full dental implants, what that is and how it works.
So there are kind of two situations of people that I will encounter that will be interested in these types of procedures. One is if somebody's had a denture for a long time. If anyone has ever worn a denture, they pretty much know that it's not a true replacement for teeth. You can smile with them, but in terms of true functionality, eating what you want to eat, living whatever lifestyle you want to eat, that can be very limited when somebody's wearing a denture. So some of the patients will come in and they say, hey, I've had a denture for 5 years, 10 years, however long it is. And they're just kind of over the fact that their teeth are removable. Like they want some teeth that they can brush in their mouth and not in their hand. And so we can place a series of implants and get a set of teeth that is secured to those implants that stay in the mouth forever. They don't come out. And so that has the ability to not only restore confidence because people can go, out to dinner, they can smile, they can travel, they can do all these things without being worried that their dentures are not going to fit or they're going to fall out. And the other thing is that their ability to eat whatever foods that they want increases significantly. When you have a full set of implants that are supporting teeth, there's really no dietary limits. So somebody who gets frustrated with dentures, they're over that, they might come to see me to talk about full mouth implants. The other scenario is a person that has teeth in their mouth, but those teeth are failing for some reason. It could be due to long-standing what we call periodontal disease, which is gum disease on the bone, which causes loss of bone over time, loose teeth, or maybe somebody that's got a very, very high cavity risk, meaning that just like everywhere they turn, they're developing a new cavity here and there. They went from having a tooth filled with a cavity to needing a crown to needing a root canal. Now that tooth has got additional problems, and either we just can no longer save the teeth or people just don't feel the confidence that they can save their actual teeth and they want to look at different options. And that's when we will introduce the idea of full mouth implants for them as well.
How do you determine if a patient is a good candidate for implants?
Yeah, there's a series of things that we need to go through. One of them is we need to make sure that they're a candidate for the implants, first and foremost. We do that by taking what's called a CBTC scan, which is essentially like a 3D dimensional scan of the jawbone. So we need to make sure that we've got enough bone to place the implants. That's like the number one rule of implant dentistry is that we have to have the bone to place it. So assuming that somebody's a candidate for these procedures, then we start talking about what goes into it, like what the patients are going to expect. How long are these implants going to last? How long are these teeth going to last? What is the maintenance for that? Then, of course, the cost. Cost is a big factor for everybody. So if all of that aligns, then we can move forward with the treatment.
Thank you for joining us today, Carrie. And we have some more Studio 4 on the way. Keep it here.
The preceding segment of Studio 4 is sponsored by Dental Renaissance.